The problem of treating lung cancer then is the same as it is today. It's a very refractory cancer, and it advances very rapidly. It's often spread before we diagnose it. Now, back in 1962, Luther Terry, the Surgeon General of the United States Public Health Service, had been asked by 4 volunteer health agencies to create a committee to study everything that could cause cancer of the lung and other cancers too. And they wanted everything included: tobacco, environment, every possible detail. It was not a popular study. Only 38% of the American people believed tobacco was harmful. At that time, many people thought it was unnecessary to do the study. There was no support in the legislature because there were so many tobacco states that were yielding $3 billion a year in revenue from taxes. Then a reporter for the Washington Star asked President Kennedy at a news conference in May of 1962, "Mr. President, the Royal College of Surgeons has just released an indictment of tobacco and cancer. What do you and your administration intend to do about this?" And President Kennedy then called a new secretary of HEW at that time and said, "Give me a report on this." So he then called Luther Terry and said, "Get your report up to date. It's going to the president. There will be no government interference in this, and you name your own committee, and they can take as long as they want to do it any way they want." I was one of the original 6. He called me and said, President Kennedy would like to have a study done on tobacco and cancer and his causes, and we think you ought to be a part of that study. None of us knew each other. Well, there had been such great studies done before, and none of them had made an impact. So, to a man, everybody said, "We're going to find a way to do this." We were looking at the holes in the information. We did that, and we finished on time. But President Kennedy was assassinated in November 22nd, and we were planning to meet 2 days later, and we had to call Mrs. Kennedy's secretary and say, "We will be in Washington at the time of the funeral, and we would like to postpone our meeting, but it will delay our getting this done." She said, "No, President Kennedy would like for you to do it." He was anxiously awaiting the information. So we went right ahead, adjourned for the funeral. Kirk attended that, came back to work, had one more meeting in December to put it all together. We had broken into some new information. A pathologist in East Orange, New Jersey, with a VA hospital, had been doing serial studies on lung cancer and smoking, and we were able to put together the first damage to the bronchial epithelium of smoking from his work, and all the way through to a full-blown cancer, so that we had what's called carcinogenesis unraveled for lung cancer. And that was solid evidence. We vetted it every way we could. We got everybody who was a non-believer, and they could not refute it. It was as solid as could be, the Surgeon General's report. That one thing really changed the tide, because the research that was done after that was so great as to be labeled by the Institute of Medicine as the greatest accomplishment in public health in that century.